Uh, well, hi, everyone. Thank you so much for having me here. And special shout out to Brian and to Jack and to other FCDC leaders for all the work that went into pulling this event together. It's really, really wonderful to see so many familiar faces and longtime friends. As Brian said, my name is not Ken Plum. It is Irene Shin. For those of you who saw the email that went out from FCDC, I assure you, I am Irene Shin, and I am running for delegate here in the 86th district. It's really wonderful, again, to be with you all. I wish it were in person, but virtual will have to do, hopefully, for now. And I know many of us know each other from knocking doors together over the years, and you've probably let me launch a canvas out of your garage. So thank you for letting me be here in community with you tonight as a candidate. First and foremost, I'm the proud daughter of Korean immigrants. My dad's a small business owner and my mom's a homemaker. When I was 16, my dad was diagnosed with cancer, and at the time he was uninsured because the cost of health insurance as a small business owner is sometimes out of reach. And so he flew to Korea, hoping to have an easier time navigating medical care in a language he was more fluent in. He spent several more weeks in Korea undergoing surgery and going through radiation treatment for bladder cancer before he came home. And at the time, I remember thinking, it shouldn't be this hard to get medical care. It shouldn't be easier for him to fly all the way across the globe to get care than it was for him to get it at home. And I decided really it's the role of government to serve our communities and that they should ensure access, whether it's access to affordable healthcare or access to your ballot box or access to your elected official. These are all components of building a healthy democracy. And that's what I focused on for the better part of my career. I've spent the last 2 years leading a nonprofit organization that builds coalitions to advance progressive policies that helps all Virginians. Coalition building isn't just a skill set that I bring to this role, but it's a value. I know what it takes to do the hard work of building consensus and delivering results. You may not always see my name or my organization's name in headlines, but we have some extraordinary wins under our belt, like expanding ballot drop boxes, eliminating the photo ID requirement. And just last year, we sued the state when the voter registration portal went down on the last day to register. And by getting a 48-hour extension, we were able to allow 24,000 new voters to get registered in time to vote. And we helped make sure everybody could cast ballots safely in the middle of the pandemic. At my job, I work with dozens of organizations to help Black, immigrant, AAPI, Indigenous, and people of color communities organize year-round to affect real change. I remember when I first moved to Northern Virginia all those years ago to work for John Faust, and we had a veto-proof superminority in the House of Delegates. Look at us now with the Democratic trifecta. Obviously, the progress that's possible when you have real leadership at the helm, it's incredible, but we should not mistake proximity to change for real leadership. Unfortunately, the 86th district doesn't have that type of representation in Richmond right now. The 2021 VPAP, or Virginia Public Access Project, legislative rankings came out recently, and our current delegate is ranked the 4th least effective member of the House Democratic Caucus. 52 out of 55. And that's just not good enough for me, and that's not good enough for our community. I'm running for delegate because our community deserves hardworking and transparent leaders in Richmond. I will work to prioritize getting economic relief directly into the hands of impacted folks, and we need to center our students and give them access to a safe, world-class education, and we need to get paid family medical leave for our workers, and ensure that everybody has access to affordable, quality healthcare. The urgency of this moment, the threats we face, from climate change to the collapse of our democracy, it demands competent and progressive leadership. We've had a history of electing hardworking community. Ooh, sorry. I'm just going to drop off and say thank you so much. I really appreciate it. I hope I'll have your vote, not just in tonight's straw poll, but where it really counts on June 8th and during the early voting period. Thank you.
All right, thank you. And last but certainly not least, Delegate Ibrahim Samirah, or Samirah. I knew I was going to do it right, and then I didn't. So, but
you got it. You got it at the end. It's all good, Brian. Thank you so much, Brian, Jack, FCDC. Nice to see you all again. Just 1 week later. Save the best for last, right? I hope we excited you throughout this night. My colleagues and I have accomplished so much. You've heard a lot about it. I want to start off by reintroducing myself to folks that don't know me. I'm Dr. Ibrahim Samirah. I grew up as an Afro-Arab in the Chicago suburbs. I enjoyed a typical American childhood. That all changed in middle school when my father traveled to Jordan, took care for his ailing mother, and was denied re-entry into the U.S. by the Bush administration. My family uprooted and relocated to stay together and fight for my father's reinstatement. It took 11 years, but my father won his reinstatement. Worked hard in school so I could one day return to the country I loved. I came right back here, attended American University, then went on to Boston University for dental school. built myself up as an organizer and activist on campuses, and that's a lot of the foundation that I know today. Today, I run a community-based dental practice as well, serving patients throughout Metro DC. Of course, now I serve in the Virginia House of Delegates to give back, helping families stay healthy with more opportunities to succeed and more time to spend together. Been proudly representing, progressing, delivering you on healthcare as a human right, quality housing for all, making wages more livable, environmental justice for all, and of course, a healthy democracy. Those are core issues for me. I've been working very hard on that. Passed the record number of bills as a freshman of any freshman led delegates during my 2-year term. Been working pretty hard on affordable housing, seeking to create advisory groups to find a way to legalize accessory dwelling units. I'm so proud of our Fairfax County Board of Supervisors. They just approved accessory dwelling units as part of their ZMOD plan. That's going to go a long way to making sure that we have quality affordable housing for all. I passed bills to require cities to coordinate better on land use as well, making sure we use our public transportation systems, that we spend so much money for people that need it. I pushed bills out that require advertising of real estate properties to notify customers if they are using arbitrary school grading systems. As you know, there's a lot of discrimination in the grading of our school systems. A school that's predominantly Black will have a 3.0 rating, and a mile away, a school that is predominantly white will have a 7 rating. I don't think there's a school that exists that's a 3 rating, but so does that, and I sought to combat that. I last fought very hard to make sure that we have all the costs associated with getting universal health care under study. Currently, we are not on that pathway. We are not on the pathway to creating a quality, affordable health care for all. And I'm a big proponent of that as a doctor. I see patients coming through the door all the time telling me they can't pay for their bill and they have to sacrifice a mortgage. I don't want anybody to have to sacrifice quality, affordable housing or quality, affordable healthcare for each other. We want both to exist for everybody. Last but not least, passed a bill just this year to make sure that Medicaid and FAMUS is given to every child. Currently, we have about 92,000 children. Now, this bill would make sure that 52,000 children, on average, that go through our justice system in child separation hearings receive Medicaid and FAMUS for themselves. I'm not sure how much time I have left.
You're at the end of your time.
Wrap up. So much more to come. Thank you, Brian, and appreciate all you. And I ask for your vote. Thank you so much.
All right, thank you. I mean, it was great to hear from all of our